Princess Lerato M Foundation, in collaboration with the Baphiring Traditional Authority, will be launching Baphiring Psychosocial Support Center at Mabaalstad Village in the Northwest Province next month. The launch will be preceded by a series of mental health workshops which will be conducted by a team consisting of psychologists, pastoral counsellors and motivational speakers. The centre will offer services such as counselling, support groups, mental health education and awareness campaigns, as well as home-based care services. That sounds like quite a lot. And this will be given to residents of Mabaalstad and neighbouring villages in the Northwest Province. Well, to tell us all about it, we're joined in the studio here by Princess Lerato Mabalane herself from the Baphiring Mabalane Royal House. Princess, good afternoon and thank you very much for coming into the studio.
Good afternoon. Thank you.
I need to be grateful to you for bringing colour into the studio. You know, you just brought colour. I'm in grey like the clouds outside, but you're wearing a beautiful, you're holding a very beautiful cover there, which is wonderful. Tell us about this. Why did you think you should be doing this now?
With the current economic conditions of not only our country but internationally after the pandemic, we've seen a lot of job losses. We've seen high dropout rates in varsity students, even high school students. There's a lot of uncertainty, instability, and that naturally leads to a rise in cases of anxiety disorders, depression, mood disorders, substance use and abuse has gone up. There's definitely a cry for help, so we thought, let us stand up, let's collaborate with different stakeholders and make a difference. Yeah,
I've had other experts saying that yes, we've dealt with COVID-19, the pandemic, but the next pandemic that is very big in our lives now, it is mental health.
It is.
What are the kind of things you're seeing on the ground in the Northwest?
Oh my goodness, we are seeing a lot of relapse in psychiatric patients not taking their medication. They're getting episodes. There's one that we were dealing with just 2 weeks ago where a mother stabbed her daughter who's in matric due to a relapse.
So it's really serious. We also, is it SIDAC, the South African
Depression and Anxiety
Group, telling us about the spike, the increase in suicides in the country. Are you seeing that happening as well in your part of the world in the Northwest?
We are. It's a global crisis that we are dealing with because the pandemic was global. It was not.
You've chosen to launch this in Women's Month. This new center, the Baphiring Psychosocial Support Center. Are you going to be focusing there on on young women and women only, or is it going to be open to everybody?
It's open to everybody. The foundation has done a lot of GBV work already, so the foundation has been laid. So we continue with women and girls, but we are not excluding. Mental health affects men just as much as it affects women, so we are not excluding them in the services that we offer.
So it's just coincidental that you're going to be doing that. So are you going to be using professionals? Because I mean, psychosocial support is easier said than done. You need people who are really qualified to help the individuals who desperately need the assistance.
Definitely. Our team consists of a resident social worker at the village who is going to be providing services such as counselling, because it needs to be professionalized for us to see tangible improvement. And then we also have community care workers, volunteers, and we continually ensure that they go for training so as to ensure that our services are professional.
Okay, just tell us about the launch itself. It's happening on the 2nd or the 3rd of August?
On the 3rd and the 4th, we have mental health workshops for high school students. We have 5 high schools within our region, so that will be workshops for high school students. And on the 5th, it's a mental health workshop again for invited guests and community members. And then we launch the center officially on Friday, the 5th of August.
Personally, why is this important to you?
I have always been passionate about mental health. I studied psychology at the University of Johannesburg, and as royals, people see us as solutions to their problems, our community members. We carry these heavy titles. We need to use them in an impactful way, in a positive way. So I'm passionate about it, and it's something that I'm excited to do in this lifetime.
Like everything else, you can't do it alone. Have you got support? Have you got collaborators? Have you got partners on this important initiative?
Yes, the response has been beautiful. We have BMW, Rustenburg supporting us. We have Mobicel, Standard Bank, IBR Holdings. We have Department of Education, Bojanala region. We have government royal leadership, NGOs, private companies. It's a beautiful medley of stakeholders who saw the need for what we are doing.
Yeah, South Africa, besides the mental health thing, is facing a lot of other challenges. In your first answer, you mentioned the economy. There's also youth unemployment. I mean, it's the highest ever in the history. And if you look at the numbers, absolute numbers of unemployment, more than half are young people. I mean, in supporting, giving the psychosocial support, it's one aspect, but they would need more than that. Is your foundation also doing other good work in the community?
Outside of the foundation, as a royal leadership tribal authority, we do seek opportunities for our unemployed youth. We have learnership programs. We have collaborations with stakeholders such as NGOs to try and bring in opportunities for fokotsa botlhokatiro ko motseng, because that alone helps us.
Yeah, because we are told, when we talk about GBV, you've mentioned GBV as well, that financial independence, particularly for women in rural South Africa, is a big issue, because they are so highly dependent on the male head of their household, that when there's no money, as you said, when there's no job, sometimes because of substance abuse and because of aggression, you end up with GBV.
Absolutely. You are dependent. You cannot leave. You cannot stand on your own feet unless if you have the right kind of support, financial support, emotional support, a structure. Cohesion, social cohesion goes a long way in ensuring that individuals make informed choices that will improve the quality of their lives.
Yeah, I guess this is not a once-off.
Definitely not.
You're starting it
it's
now.
Only
we are
the
launching
beginning.
The center. This is going to be a center that's going to be a living center. I guess you're going to run programs from the launch in early August into the future.
Into the future. I'm also a member of South African Royal Princesses Network, so we are in talks with some of the princesses.
Do you know Princess Khabo from the Free State?
She's a very close friend of mine, okay. Princess
I've
Khabo,
interviewed her as well, because she's got projects here. Just a general question. I mean, unless we've missed it in the media. I mean, we talk about what people are doing, but suddenly we are seeing this positive, this rise of royal households, or traditional households, like yourselves, and like the Princess Khabo of this world in the Free State, and others, as you said. You've got this national association of yours coming out to the fore and say, we are here to do stuff. What has changed? What has made you to do this now?
There has been a change in society that is not necessarily positive. There's been moral decay. There has been rise in GBV. And if there's a saying that evil continues for as long as good people do nothing about it. So there was definitely a need for us to come out and collaborate and pool resources and fight these social ills that we are seeing in our communities.
Yeah, so there's lots of projects that you're going to be busy with and you're collaborating with going forward.
Yes.
If there's a message you might have to, let me just, as we're about to conclude, you as the Princess Lerato M Foundation, you want to give out to people who are currently struggling with mental health issues. You've studied psychology. You are now beginning this psychosocial support center in your part of the Northwest. What would that message be?
The strongest message is to break away from stigmas and discrimination, and abuse comes from that. Let us inform ourselves. Let us get more educated about what mental health illness is, and let us stop worrying. There's a syndrome called "what will people say" syndrome. If you are suffering, forget about what people will say. Do what is best for you to begin the healing process. Yeah. So my message is to stand up and begin the healing process.
And don't feel stigmatized or stigmatized. Yeah. Thank you very much for your time, Princess Lerato. Before you go, by the way, I could not even get the name of this beautiful, colorful thing. Is it a shawl? I mean, in English you'll say it's a shawl.
I actually...
this thing.
We visited a village in Kwandebele under King Magodongo Mahlangu. Okay. So the princesses, from one princess to another, they made this for me and ensured that I went home dressed in Isindebele regalia.
Properly. Thank you very much for that. Thank you. That's Princess Lerato Mabalane from the Baphiring Mabalane Royal House in the Northwest.